Hi, this is Dr. Kazmi. Today we're talking about something every person with diabetes, or at risk of diabetes, must know: diabetes complications. Diabetes means raised blood sugar levels. Sounds simple, but it can affect almost every organ in your body. Why don't we want high sugar? Because too much sugar in the blood acts like a slow poison. It damages small and large blood vessels, nerves, eyes, kidneys, and even your heart. Let's start with short-term effects. Feeling very thirsty, going for a wee more often, feeling tired and weak, blurred vision, sudden weight loss, especially in type 1 diabetes. If sugar gets very high, dangerous emergencies can happen like DKA, which stands for diabetic ketoacidosis. This mostly happens in type 1 diabetes, when your body starts breaking down fat for energy and makes acids called ketones. The symptoms you might notice are vomiting, stomach pain, fast breathing, and even confusion. Then there's HHS, or hyperosmolar hyperglycemic state. This is seen mostly in type 2 diabetes, with extreme dehydration and very high blood sugar. If it's not treated, it can actually lead to coma. Now let's talk about long-term damage. We usually divide them into microvascular, which means small vessels, and macrovascular, which means large vessels, complications. High sugar damages small blood vessels in the eye. So let's talk about the stages and symptoms of retinopathy. The stages include background retinopathy, pre-proliferative, and proliferative. Now, the symptoms you might notice are things like blurred vision, floaters, and in severe cases, there can be sudden vision loss. If retinopathy isn't treated, it can actually lead to blindness. So, how can you prevent it? Well, yearly eye checks, also called diabetic retinopathy screening, are really important. Keeping your blood sugar under good control and also managing your blood pressure and cholesterol can make a big difference. When it comes to treatment, there are a few options, such as laser therapy, injections in the eye, and in severe cases, surgery. High sugar levels can affect the filtering units in the kidney, which are called glomeruli. So, one of the earliest signs of nephropathy is a protein leak in the urine, which is called microalbuminuria. As the condition progresses to a later stage, you might notice symptoms like swelling of the legs, high blood pressure, and feeling very tired. There's also, a risk of kidney failure, which may eventually require dialysis. Now, when it comes to prevention, yearly urine tests are really important. It's also essential to keep your blood pressure under control. Sometimes medications like ACE inhibitors or ARBs are recommended if needed. And of course, maintaining good sugar control plays a big role in preventing nephropathy. Let's talk a bit about nerve damage, also known as diabetic neuropathy. There are actually different types. So, let's talk about the different types of neuropathy and their symptoms. Peripheral neuropathy can cause tingling, numbness, or even a burning sensation in your hands and feet. Then, there's autonomic neuropathy, which actually affects things like digestion, bladder control, and heart rate. Now, when it comes to GI complications, gastroparesis can lead to delayed stomach emptying, nausea, and vomiting. You might also experience diarrhea or constipation because of bowel nerve damage. Other risks include erectile dysfunction in men and urinary incontinence. Damaged nerves and poor blood flow mean you're at a much higher risk for serious foot problems, which can be honestly quite concerning. Slow wound healing, a higher chance of infections, and foot ulcers are all risks you need to be aware of. In severe cases, this can even lead to amputation. But the good news is, prevention is possible. Daily foot checks, wearing proper footwear, and regular visits to a podiatrist can really make a difference. High sugar, cholesterol, and blood pressure increase risk of Heart attacks, strokes, and peripheral artery disease, or PAD, are all more likely when these risk factors are present. That's why, cholesterol and blood pressure management are such important parts of diabetes care. People with diabetes are at higher risk of infections like urinary tract infections, skin infections, and even pneumonia can occur, especially in certain situations. This can happen due to a few different reasons. Too much insulin, skipped meals, or excessive exercise. These are some common causes. The symptoms might include sweating, shakiness, dizziness, and confusion. If left untreated, it could lead to seizures or even unconsciousness. Keep blood sugars under control. Regular follow-ups with your diabetes care team are really important. Routine tests like HbA1c, kidney function, cholesterol, eye screening, and foot checks can make a big difference. A healthy lifestyle is also key. So, a balanced diet, regular exercise, quitting smoking, and weight management all play a part. And of course, take your medications as prescribed. Diabetes doesn't have to damage your body, but only if you stay proactive and stay informed. Thanks for watching. Like, share, and subscribe. For more detailed diabetes care and lifestyle tips, join Smart Living with Diabetes by Dr. Kazmi. For general health topics, follow Health is Wealth by Dr. Kazmi. Your health is your wealth. See you in the next video.